The number 4 sign is feeling frequent pain when waking up, and unexplained pain can be another alarming sign that something is not right in the body, and in some cases can indicate the presence of cancer. Now, these pains, they can manifest themselves in different parts of the body. Oftentimes, they are underestimated or attributed to things such as stress, poor posture, or even aging. However, when these pains arise persistently without an apparent cause, and especially when waking up, it is time to be alert. The types of cancer that most commonly cause pain are those that actually spread to the bones, muscles, or nerves, such as lung, prostate, and breast cancers, and particularly bone cancer. Now, bone cancer or bone pain is one of the most characteristic symptoms of advanced cancers, such as metastases. Breast cancer that frequently spreads to the spine, ribs, or hip. Now, this type of pain is generally described as a deep, persistent pain that worsens over time and does not improve with rest. Now, a study published in the Pine Research and Management Journal highlights that pain is one of the most common symptoms in cancer patients and can be felt acutely or chronically, depending on the type and stage of the disease. Now, chronic pain associated with cancer is often caused by tumors pressing on the nerves or organs, which can result in a feeling of heaviness, burning, or stiffness upon walking, especially when the person actually spends a prolonged period in the same position. Now, this happens during sleep. In addition to that, tumors located in organs such as the pancreas or liver can cause abdominal pain that radiates to the back and is more intense when waking up. Now, many patients too also report that they feel this pain when they get up before starting their daily activities. These symptoms, they can be confused with things like muscular or lumbar problems, which can delay the correct diagnosis in cases of lung cancer. Now, the pain can be felt in the chest or shoulders, worsening with deep breathing or sudden movements. This pain is caused by the invasion of the tumor into the structures around the lungs, including the nerves and the ribs. Now, people who often wake up feeling pain after a night of sleep and not finding an immediate explanation should seek medical help urgently. However, at times this pain can occur because it is an early sign that cancer is developing. Now, cancers that affect the nervous system, such as brain tumors, or cancers that have spread to the spine, can also have sharp, persistent pain, especially when waking up from the bed. Now, a cancer patient actually reports that intense headaches, pain that worsens when you get up or after a period of rest, can be an early symptom of a brain tumor. Now, in these cases, the pain is caused by the pressure that the tumor exerts on the brain tissue or by increased intracranial pressure during the night. Now, another related condition is neuropathic pain, which is common in patients with cancer that affect the nerves. This pain is often described as a burning sensation, tingling, or electric shocks, which can intensify upon waking. Now, these tumors that compress the nerves can cause this type of pain. And this type of pain is usually persistent and difficult to relieve with conventional pain medications like over-the-counter medications that you get at your drugstore. And According to the World Health Organization, approximately 30 to 50 patients diagnosed with cancer report persistent pain, often felt in the first hours of the day before taking measures to relieve them. Now, this occurs because during sleep, the body remains immobile for long periods, allowing the tumor to exert greater pressure on affected nerves, muscles, or bones, so making the pain more noticeable. Now, upon waking up, what this research, another research that was done, published in the Oncology Nursing Forum, revealed that many cancer patients reported that morning pains were one of the first symptoms they noticed, but that in many cases they attributed these pains to trivial causes. Now, this underestimation of symptoms contributes to late diagnosis and more complicated prognosis. Therefore, it is very crucial. Do not ignore frequent and persistent pains when waking up, especially if they are accompanied by other signs mentioned above, such as extreme fatigue or unexplained weight loss. If you realize that you are waking up with frequent pains without a clear explanation, and these pains are persistent, seek medical advice immediately. This simple action can make all the difference between identifying the problem early or allowing it to progress silently. Now let's look at the final sign. Sign number 5 is unusual swelling or lumps. Now, the appearance of swelling or unusual lumps anywhere on the body is one of the most alarming signs that indicate the presence of cancer. These swellings can occur in places such as the neck, armpits, groin, and even the abdominal region, and their appearance can vary from small and discrete nodules to larger masses that are visible and palpable. It is essential to be attentive to these alterations since they are often one of the first signs that something is not right in the body. Now, swellings, they can actually cause by the enlargement of lymph nodes, which are glands responsible for filtering harmful substances from the body, such as cancer cells. And the American Cancer Society, a report was done, highlights that when cancer cells spread through the body, they often lodge in the lymph nodes, which causes them to increase and consequently the appearance of visible lumps. These nodules, they may be painless at first, but over time they can become tender and cause discomfort. These types of cancers that mostly frequently present with unusual swellings are lymphomas that affect the lymphatic system. Lymphomas can actually cause enlarged lymph nodes in the neck, armpits, or groin, as we said earlier, and leukemia can also result in abdominal swellings due to the accumulation of abnormal blood cells. Now, a study that was done, that was published in the Journal of Clinical Oncology, highlighted that patients with lymphoma often report the presence of visible nodules in the initial stages of the disease, which may be a crucial indicator for early diagnosis of other types. Cancer such as breast cancer can actually manifest itself with the appearance of lumps in the breast or in the armpit region. These nodules can be identified during self-examination or routine medical visits. The American Cancer Society also emphasizes the importance of regular self-examination since early detection of nodules can significantly increase the chances of successful treatment. So, It is also very important to mention that testicular cancer can present with swellings or nodules in the scrotal region. Studies show that testicular cancer is more common in young men, interestingly, yes, and early identification of a testicular lump can lead to prompt diagnosis and effective treatment. The Urologic Care Foundation, what they actually do, they recommend that men undergo regular exams and watch for any changes in that region. Liver cancer also and pancreatic cancer can also frequently cause abdominal swelling related to the presence of tumors that occupy space. And when you press on adjacent organs, these conditions are often accompanied by other symptoms such as existing abdominal pain and unexplained weight loss. Now, it is very essential to highlight that although many lumps and nodules can be benign, such as cysts or lipomas, any alteration that persists for more than a few weeks or increases in size should be evaluated by a doctor. Yes, early diagnosis may be crucial for the effective treatment of various forms of cancer, increasing the survival rates and reducing the need for more invasive interventions. Now, another research published in the Oncology Nursing Forum indicated that patients who noticed changes in the form of swellings or lumps in their bodies reported seeking medical attention more quickly, which resulted in earlier diagnosis and, in many cases, in less aggressive treatments. Therefore, if you notice unusual swellings or lumps in your body, it is essential not to ignore these signs. Seek medical advice immediately. Since we cannot overemphasize this, early detection can make all the difference in the success of the treatment and in your quality of life. Remember that taking care of your health is a serious commitment and that your attention to signals from your body can save your life. Prevention is the best remedy. Now, what can you do to reduce the risk? Now, we know that prevention is one of the most powerful tools in the fight against cancer and any other chronic diseases. Although there is no guaranteed way to completely avoid cancer, several strategies can actually reduce significantly the risk. Now, here are some actions that you can implement in your life to actually protect your health and reduce the risk associated with cancer. And these are backed by studies and research. 1. Maintaining a healthy diet. Balanced diet is essential for cancer prevention. According to the World Health Organization, intake of fruits, vegetables, whole grains, and lean proteins is associated with a reduced risk of several forms of cancer. Studies also show that a diet rich in antioxidants and fiber can help protect the body against cancer cells. Another study published in the Journal of the National Cancer Institute found a connection between eating fruits and vegetables and a reduced risk of colorectal cancer. So engaging in regular physical activity, yes, regular physical activity, doing exercise, not only helps maintain a healthy weight, but also plays a crucial role in reducing cancer risk. The American Cancer Society recommends at least 2 hours and 30 minutes of moderate physical activity per week. And a study that was published in Cancer Epidemiology Biomarkers Prevention showed that regular physical activity can reduce the risk of breast cancer and colon cancer. In addition to that, helping in weight maintenance, avoiding tobacco and alcohol. Now, tobacco is one of the main risk factors for several types of cancer, including lung, mouth, or esophageal and bladder cancer. According to the Centers for Disease Control and Prevention, the CDC, about 30% of all cancer deaths are related to tobacco use, and excessive alcohol consumption has also been associated with an increased risk of breast, colon, and liver cancer. Now, another research that was done at the National Cancer Institute states that limiting the intake of alcohol can help reduce the risk, maintain a healthy weight, and prevent obesity. Now, we know that obesity is associated with an increased risk of several types of cancer, including breast, prostate, and liver cancer. So, the National Cancer Institute notes that maintaining a healthy weight can be an effective strategy to reduce cancer risk. Now, a study that was published in the Cancer Research revealed that weight loss in obese people can reduce the risk of cancer and improve general overall health. So, knowing your family history, understanding your family history of cancer can also help in identify if you are in a risk group, higher risk group that is. So if there's a family history of cancer, it is very important to discuss this with your doctor, who may recommend additional screening or specific preventative strategies. And also, the National Comprehensive Cancer Network, another research, highlights that people with a family history of certain types of cancer may benefit from genetic testing to evaluating your risk. In summary, adopting a healthy lifestyle, being attentive to your body, and making regular medical consultations are fundamental steps for cancer prevention. These practices not only help reduce the risk of developing the disease, but also promote a better quality of life. Remember that prevention is always the best path, and that with the correct information, you can make informed decisions about your health. Powerful anti-cancer recipe based on scientific study. Food also plays a crucial role in the prevention and treatment of diseases. Now, including cancer, a natural recipe that is powerful, that has gained prominence, is the green drink of turmeric and ginger. This recipe is an effective tool for both those who want to maintain robust health and for those who face diseases such as cancer. However, it is vital to remember that if you are undergoing medical treatment, you should consult your doctor before incorporating this or any other natural recipe into your diet. Now, some medications may have adverse interactions with certain natural foods. So please, professional guidance is essential before you take this drink. Now, let's talk about the ingredients and what this drink consists of. Now, in a blender, you're going to add 1 glass of warm water, add a tablespoon of turmeric powder, a tablespoon of fresh ginger grated, the juice of half a lemon, a tablespoon of honey. Now, this is optional. A handful of fresh spinach and a handful of kale. You're going to blend that very well in their blender. Then you're going to strain the mixture, or if you want to incorporate all the fiber. But you can strain it to eliminate some and drink this immediately and consume it. Now, it is recommended to drink this in the morning on an empty stomach to maximize the absorption of these nutrients. Now, it can be consumed daily for a period of 1 to 3 months, depending on the necessity and medical guidance. Now let's talk about the medicinal properties and benefits of each of these ingredients that we use in this drink. Now, turmeric. Turmeric contains an active compound with powerful anti-inflammatory and antioxidant properties. And studies have shown that curcumin may help inhibit the growth of cancer cells and induce apoptosis, programmed cell death. Now, in various types of cancer, including breast and colon cancer, a study published in the Journal of Cancer Research concluded that curcumin can reduce the proliferation of cancer cells by up to 70%. Yes, you heard that right. Let's look at another ingredient that we use, ginger. Now, ginger is known for its anti-inflammatory and antioxidant properties. Research indicates that ginger can help reduce the growth of cancer cells and prevent metastasis, especially in colon and pancreatic cancers. A study in cancer prevention research showed that ginger extract can reduce tumor formation. Let's look at another ingredient, lemon. Now, lemon is rich in vitamin C and antioxidants that help strengthen the immune system. Studies have shown that the vitamin can play a role in protecting against cancer and chronic diseases. And the acidity that is in lemon can also help detoxify the body and promote better digestion. Now let's look at another ingredient that we use, spinach. Now, spinach is an excellent source of antioxidants, vitamins, and minerals such as lutein, which are carotenoids associated with reducing the risk of cancer. A study published in the Cancer Epidemiology Biomarkers Prevention suggested that regular intake of spinach may be linked to a lower risk of breast cancer. Collard greens are rich in glucosinolates, which are chemical compounds that can help detoxify the body and reduce the risk of cancer. Now, research shows that these compounds can interfere with the development process of cancer and inhibit the growth of cancer cells. Also, another study in the American Journal of Clinical Nutrition found that the consumption of cruciferous vegetables such as kale is associated with a lower risk of colorectal cancer. This green turmeric and ginger drink is a delicious and nutritious of incorporating anti-cancer foods into your diet. Not only it provides nutritional benefits, but it can also help strengthen your immune system and promote overall health. However, always remember to consult your doctor before making significant changes to your diet, especially if you are in treatment for any health conditions. This powerful recipe can be a great ally in your health journey, offering natural support that complements traditional medical care. So in conclusion, we have reached the end of this video where we explore 5 signs that may indicate the presence of cancer when you wake up, including fatigue and unexplainable excessive night sweats, sudden weight loss, pain upon waking, and unusual swelling. We also discussed the importance of medical consultation and how early detection can significantly increase the chances of success in treatment. We also talk about prevention and some actions that you can adopt to reduce the risk, as we present a powerful anti-cancer recipe, a tool that can be useful both for those who are healthy and for those facing illnesses. So, it is crucial that when you notice any of these signs, you seek medical help immediately. Do not hesitate to make consultations and tests. Your health is your priority. And remember, there is always room for new healthy habits, both physically, mentally, and emotionally. No matter what your current situation is, there is always hope. I know cases in which science and doctors discredit the cure for some people, and still these people manage to heal themselves. Now, I want to know if you find this lesson useful. If you have come to this far and you liked what you learned, leave the phrase "I carry hope" in the comments below this content. Although it may be simple, it has immense value, and unfortunately, many people will not have access to this information. But now, at this very moment, you can be a transformative agent in the lives of several people. You just have to share this video with everyone you know. I thank you so very much for watching it to the end. And please don't forget to subscribe to the channel and activate the notifications to be notified of upcoming lessons. Take care.